facial examination. Okay, that's good. Alright, give me your name, please. Okay. And your date of birth. Good. And you are having this facial examination about the Botox and plastic surgery you're looking into. Okay. So I'm going to be doing your examination. And I just want to ask you a few questions first, okay? How long have you been thinking about doing this surgery? Okay. And what is exactly the procedure you wanted to do with us? Okay. And what information, what do you know exactly about how the procedure goes? Okay. Just stuff that you read online, okay. Did you read anything about the aftercares and the time of to the healing process and everything? Okay. So you know the basics. Good. Okay. Of course, that after we do the whole thing, we're gonna give you, all the explanations about what you need to take care and everything, but yeah. Okay. So, and what procedure exactly, do you have more than one procedure you're looking to do? Okay. And do you have any specific corrections that you want? Like how specific? Okay. Okay. And these things are, permanent, so it's quite difficult to undo them or change them after. Okay. Just making sure. Okay. And what are the reasons exactly behind? Okay. Just so that I have an idea exactly what it is that your concerns and everything that you could have. Do you have any questions, particularly about any of the procedures? Okay. Okay, that's good. That's fine. I'm just gonna get a look at your skin. Okay, we won't be doing any procedures today. Just want to get like a general assessment of the structure in your face and your bones and everything, and how your skin looks, and then we can move on from that. All right? Okay, thank you. So if you could just relax. Just looking at your forehead, your chin. Okay, now I'm gonna be touching your face. Can I touch your face? Okay. Just want to feel a few things, okay? Face looks good, everything looks in order, and I'm gonna be measuring, okay? Just a few preliminary measures of the current structure that you have, so that we can know exactly what we can change and how we can change, okay? So just I'm gonna write down some of these measurements. could you just, no, that's okay. That seems odd. Okay. I'm just gonna use this brighter light to look better at your skin. Okay. Because we have to make sure that everything is like completely there's no like scoriations, pimples, scars, just looking for things like that, okay, to make sure that the procedures that you mentioned can be done, and what results, they'll have, to ensure that they'll have a good result depending on the structure of your skin, okay. Nothing to worry about really, just standard. And if you have anything that you would like to add to the questions that I've made, you can do that, okay? Maybe now or like in the next consultation, okay? Everything is subjected to change, alright? In this first examination, we don't have to make any serious decisions right now. We can just, we're just gonna get like some idea, and then we can see, with the results that we get today, I'm gonna see what we can do, about your nose. You said you wanted your cheeks a little bit more hollow, so we're gonna, okay. So I think we could definitely, I'm just gonna just like use my pencil here to like kind of trace in your face a little bit and show you what we can do, of the things that you mentioned, what we can change and improve, okay? So I definitely think we can do a little incision here and just pull this part a little bit up, and then the same thing with this side, just a little bit, and then like we can kind of tuck in that skin, pull that skin a little bit up, and then when we close it, it's gonna give that appearance of a more arched, yeah, like you said. And then your nose, I think we can definitely open up this entire part here, pull it up, and then we're gonna like cut just a tiny little incision here. We're gonna like remove a little piece, okay? And then on this side the same thing, and then when we close it back down, like this part is already gonna be like naturally pulled and thinned, but then this part here on the sides is gonna be a little bit more, a little bit tinier. So we're gonna restructure basically your entire nose, but we're not gonna actually take out anything besides a small little part there, and then that it's not really necessary at all for breathing or anything. So it's just gonna give that like illusion. I mean, not just an illusion, it's gonna be actually smaller. We're gonna actually be able to like reduce the width of your nose, not just by the skin on top, but on the sides as well. You like that? Okay. And then on the cheeks, I think we can do, we can do, like, there's two types of procedures, okay, that we could do for a more, like, hollowed, actually three, the more hollowed appearance. We could actually try and pull up the back part of your neck here, a little bit of the skin, and then that's gonna give a sense of a more defined jawline, and with it as well, a little bit of a, it doesn't really pull that much skin from the cheek. Usually that's a procedure that we do more for the jaw, but some people opt for it because there's the two things kind of happening at the same time. These two sides of your face are gonna be a little bit more stretched, and then there's going to be a little scarring here in the back, but that will disappear, in a few months. And then there's the other procedure is we can just like do a little bit of an incision here, and then it's gonna like, we can like sort of like flatten out, we don't want to take out any actual skin or any actual muscle, because all these muscles are really important for lots of things. But we could just like cut a little bit here and then flatten out that portion, and it'll have a lot of swelling in the beginning, but that also will subside. And when it heals completely, it's gonna look very, because we'll have like pressed down with a special equipment the skin there, and then not the skin but the muscles, and then you're gonna feel even the inside of your cheeks actually kind of feels less I don't know, you're gonna have a different sensation inside of your mouth as well. Some people don't really like that kind of procedure because it kind of changes the way that they chew and the way that they feel the food inside of their mouth, because there's less sensation actually on the muscles inside. But that is one of the less invasive procedures that we have in relation to the cheek area. And then there's also the third procedure, which is actually inside of your mouth, and that is very invasive and it takes a long time to heal actually, but it's basically the same time as the others, but it'll have like more care that you have to do, over it. And also like the foods that you eat and everything, we advise you to like not have any like chewable food, just liquids and soups and things like that, so that it doesn't harm the tissues that we've changed inside of your cheek. And that procedure works in the way that we cut inside of your cheek and we squeeze out a little bit of the meat basically of inside of your cheek, and then we flattened from the inside, and then we just close it up, and then it's basically like inside of your mouth instead of outside, which some people prefer it because even though it takes a long time to heal, both of them take a long time to heal, but some people think it affects less the way that they end up feeling the food inside of their mouth after the healing is done. So it really depends on what you're looking for actually. Yeah. Okay. All right. Okay, that one is not gonna really have, from what we talked about before, what you told me, it's not really gonna have the effect that you're looking for. Like you said, you wanted very snatched, right? That's not really like pulling from the back, at least, unless we pull it like more on the top, like a lot. That's not really gonna have the effect that you're looking for. I would advise you on the second one, because it kind of like, even though there's gonna be some scarring that's gonna disappear, but that would actually give you like the flattened look that you're looking for. Okay, no, that's okay, that's totally fine. It's up to you, and like I said, the next consultation we can look into all the options with more details and everything, and you can rethink, any decisions. So yeah, okay. And then, I mean, yeah, basically your nose here be pretty easy. Just get it up and then cut the sides, pull it back down, close it up. And then also, like, we have some equipment, some type of like clasps. I mean, it's not really the name, but we can call it clasps, that would like keep it all while it's healing. We would keep the nose kind of, more like pressed in, so that would also make it, more thinner, like you were saying. Okay. The inside one, I mean, we don't take out much actually, but that is not like, it's like, I mean, it gives a lot of difference. It gives like the full difference that you're actually looking for. But it's like, in reality, it doesn't really affect anything in the structure of your face or your cheek. I mean, it affects the outside structure, but the inside structure, it's just that we like kind of take out a little bit and a little bit, and then we see how it's looking from the outside, and then that, like, it's not really necessary to take out a lot to have the desired effect. Okay. And no, that's totally understandable. Yeah, I mean, it's a very invasive one, and it's very like difficult to take care of it, in the following months. But I'll tell you that, the people who have done it are really happy with the results. They really think it's although like it takes a long time to heal, it's the best one for the restructuring of the cheekbones. Okay. So I think this is it for today. I got your measurements and I got the basic idea of what you want, and you filled out the form as well online. Okay, good. So I'm gonna fill up all your information. I mean, I'm gonna gather up all your information and the things that you wrote on the online form, and also the things that you told me today. And I'm gonna see, with everything that we talked about, see what's best for your surgery, okay? And I'm gonna send you an email with everything, so be on the look for that. And our next appointment will be just one more revision over everything, and also choosing exactly which parts you want to change and everything, and deciding exactly which procedure you want to go forward with. And then after that we'll have the surgery. Okay. Yeah, no, don't worry. It's perfectly safe. It's perfectly good, and I think you're gonna love it. So, thank you so much. Bye.